child since then. That's the problem. Okay, so seasonal influenza. Again, as I mentioned, it's hard to believe that we're already back talking about flu again, but just kind of talking about the annual impact of influenza. So across all populations, the influenza accrues about $10 billion in direct medical costs. And each year, 8 out of 100 children are infected with influenza. 20 to 77 out of 100,000 children are hospitalized, and 113 children die each year. People, that are at greatest risk are going to be the elderly, young, pregnant women. So, and then any kind of high-risk medical condition that someone might have. So what do we know? We know that from last season, we saw about 42.9 million flu-like illnesses. Everybody remember how kind of late flu was this last year? It's kind of surprising. I remember I thought, ooh, we're through it, and then we started seeing it. So 17.3 million to 20.1 million flu medical visits. I know my doctor's office, if you were calling, they were asking if you thought you had flu-like symptoms, and they were trying to triage people and keep them in separate areas because so many people were coming in for medical visits. 650,000 flu hospitalizations, and then possibly up to 61,000 deaths. And we know that we are somewhere about 120 pediatric deaths. Sorry. So our vaccination rate, 64%. That is up quite a bit from last year. Last year we were at 53%? So roughly 11% increase, which is very great. Let's talk just a little bit about flu. So I don't have a slide on this, but many of you have probably heard me talk about this before. We have monthly kind of touch bases with CDC on what we order and what we disperse from our CDC flu vaccine. So historically, we order about 280,000 doses of flu. That's last 2 years. Anyway, and we don't go through all of that flu vaccine every year. So that's for our VFC population. Does anybody know what percentage that represents of our VFC population? So if you think of VFC, what's the recommendation? Or even not VFC, what's the recommendation for seasonal influenza? Everybody every year, right? So if we order 280,000 doses of flu, is that all the VFC kids in the state? No, we have about 800,000 VFC kids across the state. That's 31%. So even if every single dose was administered, we'd still only hit 31% of our VFC eligible kids. Do we waste flu every year? Absolutely. We usually waste somewhere around 20 to 30% of the flu that we have. So CDC has then started putting out these basically state ratio charts. And so last year was the first year. One state was as low as 9%. They were only ordered enough flu for 9% of the population. Anybody want to guess what the highest was? You think there's any state that orders 100% of their VFC population for flu? What do you think what do you think the percentage, the highest percentage was? 57%. How many of you would like that on the front page of the paper? Medicaid eligible kids or VFC eligible kids, only 57% of those kids can get a flu shot. Would that be a positive thing?
Yes, because then everybody would rush to get
Millie just got a promotion, right? No, that's great. Yeah, I would love that. But what actually is happening is, I think we're just allowing it to be status quo. So we have talked with AAP, we've talked with pharmacy, we've talked with manufacturing, and we have made a conscious decision to kind of step up the game. So we ordered 50% of our VFC population for seasonal influenza. So that's a huge jump. So, Alex is thrilled. The flu manufacturers are thrilled that we have that. But really, yeah, Jill's having panic attacks every night. But what we have to do is make sure that we have this vaccine and we start pushing it out. And so we're going to be looking at some different strategies, maybe provider report cards. There may be letters, like a central reminder recall that goes out to individuals under the age of say maybe under the age of 5 or under the age of 7, to make sure you contact your primary health care physician to get a seasonal influenza. What we have found is that a lot of our providers don't want to talk about flu. Flu is fine as long as they're coming in to the office for something else. So a child, when would you go in to the office? You're sick, or what else? Well, child visit. But do we have flu vaccine year round for them? You know, what if you have a child visit tomorrow? You're not going to get flu vaccine. So you're going to have to make some special effort to get that child back in. So we're going to be looking at some of those efforts. Anybody excited about that?
I just wanted to say, I think it was last year early on in the year when CDC came out and actually said the vaccine's not very effective. That was actually communicated from the CDC, but if you delved into the information, it was very effective for kids. So I think there needs to be top down this push and making sure we're getting the data correctly to the public. So if you could take care of that.
Easy. We'll just, tomorrow, we'll send out another. So CDC has contacted us and said that they would help us with some kind of media outreach and with education strategies. We don't know what that'll look like yet. We've looked at trying to incorporate pharmacy, maybe do a pharmacy pilot in a couple different counties and see if that would help. You know, again, it's going to be maybe trying to push providers a little bit to do this. And reminder recalls and provider report cards seem to be a good way of doing that. Kind of almost like a wall of shame, if you will. But usually providers are fairly competitive. No one wants to be last. They all want to be, you know, up in there, at least at the state average. So we'll be trying to work on that more. What we don't want to happen is just have bigger wastage. So we want to make sure that we use that. Any other questions about that?
I can speak
Yes.
from a personal experience. The provider's office that I worked at would not vaccinate their kids if they were not current within the last year on their well child visits, even if the person called in for a nurse visit for a flu shot. Because we did like a nurse visit only. If they called in and they were not current within the last year on their well child visits, they would not allow them to come in for a flu shot, no matter the. They had to be current on their well child visits within the last year to come in for a flu shot.
Wouldn't that be a way to motivate them to do a well child visit, though?
No,
I mean,
no,
to say, we're not going to do just nurse
right,
only, but we're
then the other
doing.
part of it was then they didn't have room to squeeze them in for a well child visit because they were totally booked up.
Yeah.
So then they couldn't have either. They had to be pushed way out, so then by the time they came in, we were either out of flu shots or they weren't guaranteed and they had to wait. So.
Just as a little piece of that, we still have flu vaccine, obviously it's expired, but we had it, almost 40,000 doses at the date of expiration. And so that's never an issue for our side of it, so it's the private side that becomes more of an issue, but availability-wise, we did have orders well into May, and we had the doses available. Not always the presentation that we wanted, but we did have.
No, I don't work there anymore, and I know why that office didn't have the flu vaccine. I'm just saying why the kids didn't get their flu shots.
Absolutely, I'm just sharing that.
No,
Yeah.
Please don't
So-
think that it's too late in the season. Always come back and ask us if we have additional doses, because we typically always do.
No, there was a reason why we didn't have our flu shots. I know why we didn't have them.
We can't fix all that.
No, I know why they weren't, because I was
Well-
part of the reason of trying to resolve it. I know why we didn't have them.
So, you know, I think we just need to focus on the fact that flu is real important. We need to really stress on this. Yeah, I'm being told that CDC, this is a bigger priority right now than HPV. You know, and HPV has some long-term effects, and we're still marching forward with HPV, but seasonal influenza is something that's very low-hanging fruit that we got to be able to hit. Lisa?
I was just going to respond to Melissa. When we were at the National Adult Influenza Summit, the CDC did talk about the fact that they really poorly communicated flu season this past year, and that they were leaning towards no longer talking about effectiveness of vaccine and talking about reduction of disease burden with flu vaccination, because that's really where you see the most benefit. And so the CDC, I think, is well aware of the impact they had on flu vaccine last year, and are changing that direction.
Actually, that's a perfect segue into the interim effectiveness statement. Yeah, Sharon.
Right. Totally crazy thought. Just popped into my head. I don't know why it just now popped in my head. Why is the seasonal flu vaccine not a school requirement? Schools require vaccines for illnesses that children can get at school. Okay, well, one of my elementary schools only had 26 kindergartners out 1 week. The elementary school had over 30 kids out the following week. So I think that we know that it started at school. So why don't we make it a school requirement?
Go a step further, you could do that registration, you can have information about registration, plus you can put it on the ISHA athletics, so those kids,
But that's in April. That new form comes out in April. They start getting those in April. So it's a little too late for the new flu season. Registration might be a little too early.
Back to school,
Back to school. Everybody's having back to school registration right now.
But we don't
But we don't
have
have
vaccine
vaccine.
paperwork.
But they can still have information about it.
What's that? Did everybody hear what Lori said?
No.
So they actually have the CHIRP, like the CHIRP consent form for flu vaccine at registration. Have them fill it out, even though it's early. They still have those, and then you can go back into the school, do school-based clinics. Yeah, that's a great idea.
How are those consents valid?
I don't know the answer to that.
Ours are valid for 6 months.
I think it depends on how you set it up with legal and what they've said. Our association.
I didn't know what you said.
They we check their insurance before we do it, but then we have a staff with papers to go through.
So we can do it that early. They can do it the first day of August, even though we may not be getting in until October. Okay, so back to my original question.
Yeah, so that's something we've talked about in the past. It's not something that has really been brought up. I'm not saying we can't look at it. If that is of interest to people, we can definitely talk about that. I'm not sure how much traction we would get. When would you, because here's the thing. School requirements are, Indiana state law says that first day of school, child has to be fully vaccinated. First day of school could be next week, could be 2 weeks from now. We don't have flu vaccine. So how do you do that? Do you say that all these vaccines have to be updated on the first day of school, and by December 31st, all children have to be compliant with the seasonal influenza requirement? Then you've got school nurses checking twice. You've got all these kids have to be seen by the docs in only 3 months. It's probably some of the busiest 3 months. I mean, I'm not opposed to that. I'm just trying to think of the logistics of how that would all work.
A lot of schools go through their, what's it called, in November when they're all start.
Exclusion.
Thank you. Lost the word. A lot of the schools do their exclusions like before fall break. Some schools have 2 weeks for fall break, some don't. Fall break's usually in the end of October. So, if they're going to go through the exclusion lists anyway at that time, why can't that be when flu is retired?
I'm not saying I would not
Just a
entertain
thought.
having that discussion. I'm just
Yeah.
saying we haven't. And then we'd have to kind of work through this.
Because it's a timing issue, absolutely.
It's a timing issue, and right now what we're trying to do is just to get kids to be compliant with the ones that are required. The fact that some people are looking at exclusion in November or October concerns me because Indiana law is very clear on this. Indiana law is that the very first day of school they should be fully vaccinated. If they are not, they can have one 20-day waiver. At the end of that one 20-day waivers, they should be excluded by Indiana law. This is not by school corporation thought, or this is by Indiana code.
We get them in January or in February. My kid's gonna be kicked out of school, can't go back to school next week until they get the vaccine.
Yeah.
January.
I mean, I get that, but I'm thinking we can't even get with MMR and varicella, some of the easier cells, and then you get seasonal influenza. Would we want to add that on there? And then at what point do you stop saying you're going to exclude? Yeah.
I think something of note also is there's only one state that requires flu for school entry in our entire country. Connecticut. Only one does. So I'm pretty sure several states have had similar conversations as well about to require it or not. So I'm curious whether Connecticut has it. But
Yeah, we could reach out to Connecticut and ask. But you know, Connecticut, there's only like 50 kids, so that's a pretty easy sell. All right, so just really quick, and I think what this slide is actually showing, kind of what we heard early on, it was very effective for the 6 month to 18 or so, but where it wasn't was those individuals over the age of 50. That's where we saw a lot of the ineffectiveness and again, an increase in deaths from that way. I always love these burden estimates, and then to think that the estimated number of flu deaths during the 2017-18 season, 79,000. So that would be the number of people that go to a Super Bowl. So you think, one Super Bowl event, we just wipe them all out, those are all the people that die from flu. I mean, that's a lot of people, a ton of people. So this was the highest burden that we've seen since the 2009 H1N1 piece here. 183 pediatric deaths. And I know that's what got Dr. Wharton so fired up about seasonal influenza. 183 pediatric deaths. Most of those deaths could have been, and these were normal healthy kids. There weren't, most of them were not suffering from other health conditions, or it's not like we're looking at a 65-year-old that also had pneumonia and something else. These were healthy kids that could have been prevented. Their deaths could have been prevented if they had received seasonal influenza. Estimated number of flu deaths prevented by vaccination, 8,000 people. So that's twice the number of all the hospitals in the United States. So we see there's a lot of benefit, and we all know prevention is going to be a better use of money and resources than actually going in and having to address disease when it's here. So pediatric deaths, again, we talked about 17-18 being one of the highest seasons. We've definitely seen a decrease for 18-19, but really 122 deaths, that's still too many. What's going on out there?
You're talking about
They must know
children
we're
in
talking
death
about flu
and
shots.
flu shots.
Yeah. Yikes. All right, so we want to talk just a little bit of what the flu vaccine is going to look like. So some years they change quite drastically, some years they don't. This year, we've only seen the A strain change. So instead of a Michigan A strain, we have a B strain. Instead of a Singapore, we have an A Kansas. Both of the B strains are exactly the same. So we're going to see some different circulation, we're hoping. We have seen that because of some changes that are being made, we're being told that the flu vaccine is going to be delayed just shortly. So it's a month, I heard 3 weeks to a month, somewhere in there. We're still planning on having full vaccine to everybody by October 1st, which is the date that we always communicate. That should be the date that you start your clinics, and that should be when you should promise that you'll have vaccine to everybody. Years past, we've always had it out. We usually always start Labor Day weekend shipping vaccines, so somewhere around the 1st of September. So again, that 3 weeks to a month, we may be there. As soon as we get vaccine, we will be shipping it out. It's not going to be, we have some changes that are coming about this year. As far as all of our products, except for Flu Mist and Flu Celvax, which we have very little, and we probably are not even going to put on the order form because we have so little. Will probably be special request vaccine. Will be 6 months and up. So it won't matter. You don't have to wait on 0.25 presentation. Everything that you receive could be administered for anybody in the PFC program. Does that make sense? Anybody excited about that?
Yes.
I mean, I think this is a huge thing because we've had, from the delivery aspect, when we were trying to make sure that everybody had vaccine, we didn't want to ship out vaccine until we had a good presentation of everything. And so 0.25, a couple years, we're kind of late to market. And so we were holding that to make sure that you didn't, one, didn't only have a partial order, two, that you only could vaccinate just certain individuals. You know, we had a couple of years where, oh yeah, you're over 3, we can vaccinate you. You're under 3, no, you have to come back. How many times do they come back? And then the other thing is we touch that order numerous times. There's more chances for us to make mistakes on that. So, you know, this is supposed to really streamline the process, make it easier for you guys, reduce vaccine errors, administration errors. So I'm really thinking this is going to be a good year for this. Okay. So this is not the current chirp codes for seasonal influenza. We will be putting this, but I put this in here as a placeholder, excuse me, because everybody seems to really like this form. Everybody wants to know what these codes are. So we will get this out as soon as we can. We're hoping that maybe in the next couple of weeks. BJ has been out of the country, and Jill and I have been working on some other things, so we're hoping that we can get this here soon. But I kind of wanted to affirm, this is a useful form that you guys want to have every year? Okay, yeah, everybody said shake. So. All right, so every year we do a flu survey. How many of you responded to the flu survey? So I just want to kind of put this bug in your ear that this is how we decide what kind of vaccines people want. So the more responses we get, we have a better representation or a better likeness of what people want out there. So now that all the presentations are pretty much the same, I don't know that it matters as much, but we want to make sure that we know what you want and order accordingly. So again, make sure that you send back in your flu survey. It goes out every year somewhere, usually around January 1st, maybe the second week of January. We've talked about trying to do it with the provider recertification. The only problem with that is we don't know what flu presentations are going to be ordered or be available when we do that recertification. Borrowing. So no borrowing on seasonal influenza. You could borrow, you can borrow from your private stock to do VFC eligible, but there's no guarantee what you're going to get. So we just say no borrowing. You can never borrow the opposite way. You can never borrow from VFC to vaccinate private or fully insured. So the simplest way is just to say do not borrow. Order form. So the order form is going to be pretty much streamlined because there's not so many presentations that we have to order this year or offer. We get a lot of questions about flu mist. Flu mist was not on the chart for a long time. It wasn't even available. It was made available last year. We didn't order it because we had already placed our order and we would have had additional vaccine that we knew we would waste. It was on the order form this year. We went ahead and ordered some, and then we were notified that we were only going to receive about a third of what we ordered, and it was a small representation anyway. So we ended up, just saying, look, we have a small amount. Probably we will look for special events, maybe school-based clinics or some special event that we could use that vaccine for. We're not going to have it out on the order form for everyone. I think it was like 7,000 doses is all we received. So if you think about that, that would go just probably in the first day. So, if you have a special project you're going to work on, please reach out to Jill or myself and we can talk about that. Flu cell vax, we usually order that for health bureaus to go out and do school clinics. We order a very small amount of that. Most of it is going to be Fluzone, Fluarix, Flulabal. I think that's it. Right, Jill? Fluzone, Fluarix, Flulabal.
In both single-dose syringe, single-dose vials, and multi-dose vials.
Right. The majority of it is in.
Single-dose syringe.
Yeah.
3-dose syringes. That's the majority that we order, but we do have requests for the other ones based on storage units, so we try to at least keep some available for that purpose.
Okay, order forms. We're hoping order forms will go out next week. Just like every other year, your order form is unique to your practice. So don't photocopy somebody else's. Don't get a photocopy from a pharmaceutical rep. It is yours. You have to have that order form. Okay? If you do not receive one, please try to reach out to us. If you don't have something by the middle of August and you've checked your spam, reach out to us and make sure that you have that. Remember, first in, first out for orders as well. So as soon as you get that, you want to figure out what you need and send it back in. I think, what was the record? It was...
We're at 14 minutes.
14 minutes before we receive our first order back.
I do
So-
guys. Because I mail merge 700 order forms at one click, and so then it starts shooting them out, and I think it's been 14 minutes since the time that they're first started going out in that first batch, that they send in a form. Doesn't mean that it's accurate or something, I don't know sometimes, but it goes to the primary coordinator, and it comes from immunize@isdh.in.gov. So please make sure if your primary coordinator doesn't check their email, is not the one, if you've ever put an order in and their email address is listed, even though you're the one submitting the order, that means the flu form will go to that email address. So if that is not accurate, we need to get that taken care of, because I will literally pull the list on Friday. So I have to know as soon as possible if those names need to be changed. And that's the list that I use for all flu communication for the remainder until I, have additional information. But the form is always going to have that email address and that person's name on it. I don't rerun them. It's a PDF that gets saved, and that's what it is. But if you think that should be different, then you guys have to figure out who should be listed as your primary. And then it does come with me, and I so make sure that you don't send out to spam. I mean, I've been doing flu, this is my 10th season in this role doing flu, and it has come from Immunize all of those years. So it happens the same way every July. So please make sure you guys are watching for it. And it's very difficult for us to resend 700 more of them. We've kind of got to the point that on a couple occasions we're like, we're just going to wait to send them until they call, because we're resending them every day anyway. So please just watch for it. It's a lot of work for us in the office.
Yeah, so just a couple things when you're looking at that first order. Place the order for what you need. Make sure that you're going to have enough to start. You can place an order once a month, but if you need more, we don't want you to call once a week and place a new order. But please make sure that you have vaccine. If you, order what you thought was enough to get you through a month, and you have a huge rush, call us. Let us know. We want to make sure that you have vaccine so you're not missing opportunities. Do you have a question?
We opened 2 new clinics this year, and they're getting ready to get approved for VFC. Is there a delay on the flu order forms?
They won't receive a flu order form until they've been enrolled in the program, until they're ready to place another order, until they place their first order.
So when they place their first order, it should be shortly they'll get approved vaccine. Okay, thank you.
Yeah, so you might want to check with Jaleesa. Jaleesa, raise your hand. Jaleesa's working with all of our enrollments, so you might want to check with her and make sure there's nothing that you need to finish up, so we can get you in there as soon as possible and maybe, get that order form going. Okay? And she says, Jaleesa is like, I hate that Dave McCormick. Okay, so every year we get the question about, I have, on my private side, I'm ordering only this product, or my health system only wants us to use this, so we have the same formulary. Please let us know that. There's a place on the form that you can signify that, and we will do our best to try to meet that. Now, I can't guarantee it's going to happen, but we do try to do that as much as possible. If we have the vaccine, we will try to make that happen. Can't guarantee anything. Our bigger thing is just to get vaccine out. So make sure you let us know about that. What can cause delays in ordering? Ordering boxes instead of doses, high dosage requests. Let's talk about high dosage requests. So if you feel like you need 500 doses to start with, that's fine. You might want to put a note on there why you think. Is it based on last year's uptake? You've got a big clinics that's planned. We would love to see as much vaccine go out as early as possible. We know that the demand is early in the season, not late in the season. We have talked years past about trying just to force vaccine out to all of you. Maybe look at what's on your provider profile and, okay, we're going to send half of everything that's on your provider profile to you in the first month. Well, most of us don't have the storage units for that. And then we run into the risk we'll have to move vaccine around. So we don't want to do that. But ask for what you need and, have that two-way conversation with us. If you feel like, gosh, I don't know that I can go through 300 doses in the first month, but I really want to have it because I think we're going to have a big uptake, let us know. We'll work with you and try to get that. Inconsistencies in orders. We do look, and usually it's flagged in the system, that if you order 10 doses one month and 1,000 doses the next, we're going to ask why you did that. or it's just the opposite. We want to know what's going on, and so we'll try to look for that. Incomplete doses administered and inventory on hand. We will not process your order unless we know that all of the information has been turned in. If you have a problem with it, let us know. We can try to help you with either your inventory or your doses on hand, but you have to turn in that information. Altering the order form or writing a lot of comments. I've seen a couple order forms where it was almost like all the way around. It was like they added a new border on the order form. They were trying to send us a message. Yeah, that's just not going to work. Providers sending in duplicate order forms. I sent in an order form, and I did get my order last week, so I'm just going to send in another one. What happens? You're probably going to get a duplicate order, or it's going to be caught, one of the two. So make sure, you can always call and check on it. And then crossing anything out that you don't want, or lots of scribbles. If we can't read it, a lot of times it just gets put to the side. So make sure it's clear. You can always photocopy a new one and start over. So make sure it's clear of what you want. So these are just some examples. Do you have a certain brand to adhere to for your agency's formulary? Yes. And then you're circling a couple different kinds of vaccine.
You may explain.
Yeah, I think that'd be better because that's so confusing I can't even figure it out.
So on the second example with the red X, they listed that no, they don't have a specific formulary for their facility, yet they started and put preferred and then kept writing information in and tell us what they want. Unfortunately, that doesn't grant you a specific brand in that case because you answered it as no. If we can, we might be able to send that presentation, but this just usually causes a lot of delay and could, as I always say, end up on my desk, and Lord help you if you end up on my desk because there's probably 7 other piles of things that I'm taking care of. So I would say that is not the best way to fill out that form. If you can only offer Sanofi products, then you need to choose yes at the top, then you need a brand specific one for your formulary, and then indicate, circle in the product and let us know which brand it is. But I can never guarantee, even within like Flu Zone, which Flu Zone product that you'll receive. It'll be, in this case, that was age appropriate for the time period. These are last year's order forms, by the way. The next one wrote nothing up at the top again, drew their own lines, and then told me exactly which product they wanted. And then the next one is the one that is highlighted all the way around, marking out presentations that they don't want, but maybe only think that we have left the next season. And we prefer this not to happen because when you fax anything that looks like this with lots of lines on it, sometimes those don't come through very well, and it's very difficult for us to try to decipher through there. Just remember, I'm not the one who touches all these. I have staff who do that, and they don't know all of you individually, they don't know the circumstances, so it's harder for them to make those decisions on those. So again, that would be a cautionary one. We'd ask not to make changes to the form, do as we ask, circle it. And then the caution on this one is while you may want 500 doses, you have 250 in your stock already. And we really ask that you order for 30 to 45 days. So you may only administer, you may have ordered 500 the month before and have only given half of that. And I know this is a world where we always think of ourselves, but there are some of the other providers who may not get doses if you're asking for that many. And with the current delays in vaccines for this year, it could come down to one provider gets this amount and somebody else doesn't get vaccine for quite a while. And I know that's not what we think about. It's us, me, kind of world, but think of it in the bigger picture. Can you realistically get that? We have 400,000 doses coming. I'm going to have vaccine for you. It just may not be able to be there September the 1st. It may be October the 1st. And so be mindful when you're putting that on there. We just ask that you really realistically plan for what you feel like you can give in 4 to 6 weeks, not what you, and I just said we would work with you, but within reason. If your storage unit is so full that you're removing other vaccines to store your flu, that is not appropriate, and I have had a provider in Indianapolis who did that. They took out viable vaccines from the regular schedule to store their flu vaccine. They wasted $65,000 worth of vaccine to store their flu vaccine in their fridge. Because I was an educator first, guys, so I've been in the field. No, that's never the case. You're required to be able to store your largest inventory, which includes all your back to school, your influenza, and your regular vaccines in your storage unit. If you can't store that all, reduce your order or get a new fridge.
Yeah.
Sorry, I'm off my soapbox.
Yeah, so we have streamlined the adult order form. And unless you mark a preference, we're going to send you just whatever we have. In the adult program, we definitely try to just get out as much as we can and just send what we have. It's in years past, the exact same way. We're going to send what we have to you. But if you need a special brand, let us first, certain formulary, let us know. Okay, how many of you have offered adult influenza in previous seasons? Quite a few. Is this, any of these changes going to impact what you're already doing? So I really think the fact that we've streamlined the presentations and that we're, for adult seasonal influenza, we're only offering two different kinds so we can get them out. Now different presentations with just 2 vaccines. And how, so no big impact, I think we'll be good, right? Okay, I never get the flu. How many people have heard that? I love that, I never get the flu. You know, what I always tell people is, you don't want the flu. Move through that. We have a bunch of different resources, but we want to make sure that people are fully vaccinated. Even if they do get the flu, if they have a vaccine, it will be lessened than what the impact could have been. How many of you have had, truly had Hep A where your head felt like it was going to explode? Hep A, I'm sorry, influenza A. Jeez.
It's a new
No.
symptom of Hep A.
Yeah. That's all I talk about is Hep A anymore. How many of you had influenza A where your head just felt like it was going to explode? You know, people say, oh, you know, the flu, I get the flu every year, it's not that bad. You've not had true influenza. When I had true influenza, I thought my head was going to explode. I ate everywhere. It was miserable. I would have rather had that 12 hours of throwing up and diarrhea and all that. You know, that's what most people are saying with the flu. I always like that. I got a flu shot and then it gave me the flu. Yeah, no, that doesn't happen. How do you know that you weren't already exposed? Or, you know, I got the flu shot and then I threw up for 3 days. No, that's because you ate something bad. That had nothing to do with the flu. So there's a lot of different resources out there. CDC has a lot. IIC has quite a few. We have both national resources and then local. I love this one. This was real popular last year. Spread popcorn, not the flu. Did you guys see that? How many people love popcorn? Anything with popcorn, I'm in. So again, CDC has these great resources, and you can track what the flu burden looks like weekly, monthly. You can go by state. ISDH also does a weekly flu burden report. How many of you have seen that? So a lot of people will track that as well. Oh, the only thing we're offering this year is just the quadrivalent. We've done that for multiple years now. I'm not even sure if you can still get a trivalent. Can you still get trivalent?
Like Walgreens or CVS.
Okay, but we're not offering that at all. Everything is going to be 4 strains. Everything's quadrivalent. Again, some local resources. I know Lisa and her team are finishing up the pediatric flu toolkit. You have any idea, Lisa, when that might be ready?
I actually have a preview of it for people.
Okay.
Well, wait, just wait until Dave's done. I'll
Yeah,
do it.
actually, I'm done. Is there any questions? Nope. All right, super. Thank you much.
Well, I'm Lisa Robertson, in case there's a few of you I don't know in here. I'm the director of the Indiana Immunization Coalition, and so Alexis at ISDH and Lori have been working hard getting the pediatric flu toolkit ready for this season. Especially as Dave said, he's really trying to increase that pediatric flu uptake, and not only with our VFC kids, but also with our privately insured kids, and make sure we're doing a good job protecting them. And so I just wanted to give you a quick highlight. We will have our pediatric flu toolkit. It should be on our website, I think, downloadable in maybe like the next 2 weeks. And then as like the MMWR and the ACIP recommendations come out for this season, we'll add that to it. We'll have it in hard copy probably towards the end of August. So if you have our HPV toolkit, our MinB, or Tdap, this will be the same. So we'll have the, here's actually the cover. So this is what the binder will look like. So it's the same format as our other toolkits. I don't know what I did.
You didn't do anything, I
Oh,
changed it.
Thanks. Perfect. So then inside here, just like the other toolkits that we have, there's resources for providers, there's parent resources, there's guidelines, there's, here's the table of content. So there's school and childcare provider resources, just a lot of really good information. So hopefully by the end of August, we'll have this in hard copy, but it'll be up before that on our website. So as soon as it's out and available, we'll send it out in our newsletter so that you know that it's there. Yeah, this is the old NMWR, so when the new one comes out in August, we'll update that. So the only other thing, and we have a few other flu resources. We will probably have our flu packets, our little baggies, our flu kits that have the Kleenex and the hand sanitizer and the little flu postcard in them. We probably won't have as many as we had last year. So if you want them, you guys are here, so you're lucky. If you send me an email, I have some ready to go right now. So I will start getting them out, and then once they're gone, they'll be gone. But we do still have some available. If you send me an email,